Hello and welcome. Thank you for joining us today for our discussion on navigating the future of medical education in a post-COVID-19 world. I'd like to start by introducing our panel. Firstly, we have Professor Chris Baldwin, who is our Provost and CEO of NewMed.
Good afternoon, everybody.
We have Dr. Julie Platt, who is the Assistant Dean of Clinical Affairs.
Hello, everyone.
And we're delighted to say we've been joined by one of our second-year students this afternoon. Kuhan is the president of the NewMed Student Association. So thank you for joining us. Okay, well, obviously we've all gone through major changes over the last few months, been major disruptions caused by this terrible pandemic, which has also disrupted medical education, requiring prompt and drastic action from medical educators. Health professions obviously are playing an important role in the pandemic, but it's crucial that we still maintain the ability to train our medical students throughout this period. So what I'd like to ask, firstly to Chris, is what measures has NewMed taken to ensure academic continuity and quality?
Okay, thank you very much, Fiona. I think just to everyone, just to give remind everyone that I'm sure everyone's aware that our medical program actually is awarded by Newcastle University in the UK. It's actually accredited by the Malaysian Medical Council in Malaysia and the General Medical Council in the UK. And actually, we also are accredited by the Malaysian Qualifications Agency, the MQA, and the QAA in the UK. So we have a wide range of accreditation bodies that we must meet their quality standards. So everything that we've done since we had to close down in March really has to carry on to meet all of those accreditation requirements. So that's the first thing. So the things we do have to meet those requirements. As I'm sure you will understand, it's been very hard for people to suddenly switch from full face-to-face teaching to online teaching, which is what we had to do. And that's very hard for staff, obviously, to have to change their teaching and what they do, but also very hard for students because it's a completely different way of learning, much more self-motivated, much more driven. So you're not there with your friends going along to the classes. So it's a slightly different thing. And actually, if we were going to design a new online program to run from the UK, it would probably take us 2 to 3 years to actually design that. So to suddenly go from being an on-campus teaching to online has been a big job. So really, is what we've done is we've made sure that we've met all of what are called the learning outcomes, and so students can progress as they go on through the program as they normally would. So really, I guess from my point of view is where I will see is that I will see all the students succeed as they proceed through each year, because they have to meet all of the requirements for each year for all of the accrediting bodies. And then probably a bit further as we go into the future, we'll see as our students who've actually done this, they manage to go on and they go and maybe practice their medicine in Malaysia, or they'll go and practice there in another country, the UK or another country, and see as they succeed in that. So I realize it's been a difficult change, but I think that as we see students go on, we will see that what we've done is manage them to get all of the areas that they need to do. And then just a quick add here is that we will be bringing more face-to-face teaching back as we go on. So things will change as we get new students in from September. They will have more face-to-face teaching. It won't be fully online as we are now.
Thank you very much, Chris. Julie, have you got anything to add to that?
Yeah, thank you, Chris. So I think a lot of our staff we weren't aware the pandemic was coming, and I think we had to upskill really quite quickly. So in years 1 and 2, a lot of the teaching is done on campus, and the lecturers in the first couple of years at NewMed were quite au fait with things like PCAP, which are pre-recorded lectures, whereas the staff that were teaching years 3, 4 and 5 generally do most of their teaching in the hospitals. So had to upskill pretty quickly in terms of delivering teaching online. So for years 1 and 2, online teaching did continue. It continued either in a synchronous way, which is live teaching, so live Zoom sessions or Microsoft Teams sessions. And then there was asynchronous teaching, so that would have been pre-recorded lectures, and that was generally quite well received by years 1 and 2. For years 3, which is one of the clinical years, teaching did have to move online when the campus closed. And again, that was generally well received. When the campus did close in March time, our year 4 students were doing something called the student select component, or their lectures, where they would have been in different parts of Malaysia or potentially in the UK. So that did take a little bit of time to put resources online for our year 4 students, generally because they wouldn't be taught on campus at that point in time. And for our 5th year students, they were due to do their final year exams in June, and they had to move to online teaching, so they had some formative clinical exams which were online. But on the 1st of July, we were able to bring the students back onto campus and provide some face-to-face teaching for the 5th year students, supplemented with some Zoom sessions in the afternoons. Also, the GMC, which is the General Medical Council, have several core procedures that they expect our medical students in final year to complete it. And because the campus had closed down, students weren't able to complete those GMC outcomes in March time. So we've had to bring the students back onto campus to ensure that they've had those competencies signed off. In terms of quality, the staff have had some training on PCAP, which is the pre-recorded lectures. So for clinicians like myself, we've had to have some training on how to use this. And next week, there's going to be a tutorial or a teaching session on how to use the MLE as well. When we bring the students back in September time, there will also be an induction just to help students familiarise themselves with online teaching and how to make the best of the resources. So I think it's been a big transition for staff and students alike, but I think we have tried to ensure academic continuity and quality.
Okay, thank you very much, Julie. For my next question, UMed's conducted classes remotely, as you say. From the view of faculty and students, how do you think this transition has gone? And I think it would be nice to hear a student's perspective on this first. So, Kuhan, if I can go to you.
Yeah, sure. I mean, personally, if you're talking about the transition, the experience wasn't the best because it was very sudden. So the transition wasn't a slow, gradual transition. It was, one day we were in classes, seeing our friends, and the next day we're sitting at home trying to study lectures online. So initially, coming from my experience in the 2nd year, we had pre-recorded lectures, and there are some issues with pre-recorded lectures because, it's not live. You can't really interact with your lecturer. So it's a bit harder to learn in those instances because if you have a question, you either have to email them or try and find it out yourself, but you can't really interact face-to-face as you used to when we had lectures. But it was nice that the university did upload a lot more resources, and also the lectures were always readily available. So if anyone had questions, you could email them and ask. And other than that, in terms of interactive learning, because it was towards the end of our semester, we only had about a month or so left. There wasn't much missed, but we did not have many seminars, which I think that in the future moving forward, like as Prof. Chris mentioned earlier, that there will be more face-to-face learning, or if there's not face-to-face learning, it'd be more interactive learning where it'd be a live lecture or a newly recorded lecture. But I mean, all things considered, I think UMed tried their best, and there is a lot of room for improvement, but it doesn't mean that the learning itself wasn't good in the beginning.
Thank you very much. Julie, maybe you'd like to add something from the staff perspective.
Thank you, Johan. So just in terms of trying to measure whether it's been successful, so there has been informal feedback between staff and students. The staff listening to other staff members, but also listening to the feedback from students. And I think a really important component of that has been the staff-student committee. So there are several reps in each year, and they will meet regularly with staff members involved in the delivery of each of the year's learning outcomes, and the students can feedback what has gone well and what hasn't gone so well. I think the areas that generally have gone well have been years 1, 2, and 3. I think the area that perhaps we struggled more with was the year 4 students. So generally these students, as I said before, would have been either elsewhere in Malaysia or in the UK. So it did take a little bit of time to get resources put onto the medical learning environment, which is the online platform. But we were able to put year 5 resources, make those available for the year 4 students. give them some information on clinical and communication skills, and also some risky, which is written skills examination practice questions we put there for the students to have a practice at, and also to do something called have some practice questions on situational judgment test, which is a test that some of the students will do if they plan to go and work in the UK. So I think, we are listening to the feedback from the students, and as Kuhan said, that, there are areas that we can improve and will continue to improve in those areas. Chris, anything to add?
Well, I think is what we have to realise is how quick this was. I mean, we were working, we were teaching all the time. I will say, just before we had to close, the weekend before we had to close, we had a meeting with a number of our staff, and even before the government had told to close down, we pulled out of our clinical teaching because the numbers of COVID-19 cases in Johor had increased so dramatically in early March. So we stopped the clinical teaching. So we were reviewing things suddenly as it went along, and then suddenly one day we were told you have to close the next day. So it wasn't. We couldn't really plan what we were doing easily because although we were monitoring it, we were suddenly told. And I guess this is as we go forward as well. We do have links in and communication with both the Ministry of Health and the Ministry of Higher Education. We have a number of groups that we actually have these contacts with, but as we now are allowed to go back once again, we will suddenly have these announcements from the government, which will then tell us what we can do, and then we have to work around the government and the guidelines that we get from there. So I do understand that the transition to online teaching may have had a few hiccups as it started, but it was because it was a sudden announcement, and anyone who was on campus, either staff or student, will suddenly realise one day we were teaching and one day we were closed, which I'm sure will never ever happen again in my lifetime, and I'm sure has never happened in the past. But we just the biggest thing has always been safety of all of our students and safety of all of our staff. So we follow all the guidelines as we go along.
Thank you very much. Obviously, these are very stressful times. What I'd like to ask now is how students are being supported in managing that stress, anxiety, fear, and perhaps even mental health issues related to COVID-19. And I'll start off again with the student's perspective, if I could, Kuhan.
Yeah, sure. From what I know, because personally I didn't go through it because I managed to return home in time, but I know that there were a lot of students, both international and local, who were stuck on campus and in their nearby residences. So I think the university did do a lot for them, especially in the initial few weeks, when everyone is quite scared and worried and they're not really sure what's going on. From what my friends told me, that the university provided them food and accommodation for anyone who had problems with their accommodation. For people who were staying off campus, they delivered their food to them regardless of where they were. And I know the university was checking up on the students. And, coming from a student's point of view, it's nice to know that, because, during those times you will be quite worried. And it's nice to know that there's someone there who's looking out for you. And at the end of the day, if anything were to happen, you could always go back to them, for help, for advice, And I know that they also sent out emails to making sure that all students had access to mental care help. So there was emails regarding what they should do in the off chance that they needed some help or some advice or someone to talk to. I think in that sense, the university did do quite a lot for the students' mental health.
Good, thank you. That's good to hear. Julie, any comments?
So I think, as Kuhan alluded to earlier, I think we hope that our students have good relationships with the lecturers and would feel comfortable approaching the lecturers if they did have any anxieties and concerns. But there is a more formalised structure at NUMED, so students have access to something called an academic mentor, who's an individual member of staff who would meet with students up to 6 times during the year. So after campus closed down, academic mentors were in contact with the students to make sure that they were okay and address any difficulties. Beyond that, there is the counsellor that's on campus as well. So she was able to provide Zoom calls if students were distressed or upset. And also we've got the student support team as well, who provides support academically but also emotionally for the students. And if things had required further intervention, then there's access to the psychiatrist either in person or via Zoom. So I think there was lots of structures in place to support the students, and I hope that the students felt able to come and access those support structures.
Thanks, Julie. Chris, any more comments?
Well, it's very good to hear from students that students feel supported. I think that we do have very good structures. They're based around the UK structures, and we put a few more in ourselves over the last 2 years with our Dean of Student Affairs and our independent counsellor that we also now have. So it's good to see that. And I know my feedback from the Dean of Student Affairs actually has said that there haven't been a lot of critical problems, but she's dealt and talked to a number of students about a number of issues. We as we said, we passed some on to a clinical psychiatrist at one of our local hospitals where students can talk to. I think, and this will go on into the new academic year, and we will be supporting students. So if we happen to have international students who have to remain in their home country for whatever reason, we will be supporting those students with mental health issues as well, that they can have Zoom discussions with either our staff, with our clinical psychiatrist who's in a local hospital, or they can work in country, in their own country, and we will support them that way. So it's good to hear about students, but from my point of view as CEO of NewMed, I also have to feel about the staff, because staff have also had a range of changes. So they've all suddenly gone to working at home. Some people are single, they live in their own homes, they felt very isolated. So also we put in a range of support mechanisms for staff, even if that's buddying up. So I buddy up with one member of staff who contacts me every day, and we have a bit of a chat. And so there's a range of other issues that maybe students don't see that we put in for staff as well. So I think that what is one of the good things over the last couple of years that I've helped develop, and along with Brenda, is the support for our students. I think is building up. We also have an emergency phone, so if there's a real emergency students have, they can phone up, and then we will support them and help them as well. So there's a range of things that I feel that we've got in, and I think we're doing the best that we can as we can for students in this area.
Thanks, everybody. It's good to hear that there's such a comprehensive range of measures in place for students and staff. So all universities and medical schools at the moment are making rapid changes to their curricula in response to COVID-19. But at a time when social distancing is the new normal, we're in a profession that requires hands-on learning and interaction with patients. So that presents a particular set of educational challenges. At NewMed, how will medical students gain the education and the experience they need to qualify? And I'll hand that back to you, Chris.
Okay, thanks. I will start on and give a general view, I guess, and then Julie can give a bit more detail for you. I think, firstly, that we haven't adjusted our curriculum. Our curriculum is just the same. We have all the same, what we would call learning outcomes. We have all of the everyone has to learn what they have to learn for medicine. So we can't really change anything. So I guess is what we had. I mean, we do understand that once we cancelled classes in March, the biggest problem probably was clearly the clinical teaching, when students couldn't go into any of our local teaching hospitals and students couldn't go into our local clinics where they got the GP type change teaching. But as we go forward now, is what we can see is the government and the Ministry of Health have given us a number of what's called standard operating procedures, and we can follow those standard operating procedures, and we can teach both on campus, clinical teaching, and we can teach in the hospitals. So as we go back, definitely from September, we will be teaching in our local teaching hospitals, and the deans, and some of you I know have gone to visit those hospitals and gone to our KK to look at how we do this, and we're just putting together the standard operating procedures for doing this. I think that it will be slightly different because we'll have to teach in slightly smaller groups in the hospitals and in the clinics, but we can manage that as we go forward. There will be obviously having to use hand gel to clean your hands. You'll be washing your hands more. You'll be having face masks on, and a range of different things like that. So I think as we go forward, is what we have to do is make sure that we make it as safe as we can for both our students and our staff, because we have to consider everyone. We also have to make it safe for patients in the hospitals. So if our students are interacting with patients in hospitals, we don't want them to infect a patient in the hospital either. So by following essentially these standard operating procedures that have been given to us by either the Ministry of Health or the Ministry of Higher Education, we can keep everyone as safe as we feel. And I think that students will see this as they come back onto campus in September. As Julie will probably tell you in a second, we have put some of these into place for our 5th year students that we have back on campus now, who will be doing their clinical exams in the next couple of weeks.
Well, thanks, Julie. Maybe you could tell us a little bit more about that.
So for going forward into September times, our year 1 students will be able to be back on campus. So in terms of that hands-on experience, then we'll hopefully get them into the clinical skills lab. They will have to be socially distanced by about 2 meters when they are in the clinical skills lab, but they will get some of that hands-on experience. Our year 5 students are also allowed back on campus. And as Chris alluded to, we have brought the current year 5 students back onto campus. We provided them with some additional teaching and provided standard operating procedures for that. And also their clinical exams and written exams are going to be in the next 2 to 3, are going to be run over the next 2 to 3 weeks. There's several members of staff have been going to the hospitals and the KKKs, which are like the GP surgeries, just to look at the layouts of the hospitals and hear what their standard operating procedures are and how new med students and staff can abide by those rules, but also deliver the teaching. So all of that is in progress going forward for next year. In terms of the year 2 students, I think we recognise that there's importance of learning with each other, so learning with other peers, but also from each other. So we aim to bring the year 2 students back each week at some point to develop their clinical skills as well. So the details of that haven't been ironed out as of yet. In year 3 and year 4, so there's a lot of clinical work that goes on in year 3 and year 4. And as Chris said before, each year has a set of learning outcomes, and those learning outcomes will remain the same over the course of that year. But we've got to recognise that we've had to make some changes. So we're going to move some of the learning outcomes that we've seen in semester 2 into semester 1 for years 3 and 4, and then load more of the clinical work into semester 2. So the students will receive the same experience. It just maybe shuffled around a little bit for years 3 and 4.
Okay, thank you, Julie. New question now. How is NewMed going to help students to learn about new infectious disease outbreaks and at the same time keep them safe and their contacts safe from infection? And I'll go back to you with that, Julie, please.
Okay, so when COVID first came out, I think there were quite a few emails from management to the students, just trying to keep students appraised of what was going on. But I suppose within the curriculum, there is teaching on infectious diseases. So in years 1 and 2, we cover diseases like dengue, HIV, but also there are global health modules that educate students on how to deal with pandemics. And then as the students go into the clinical years in year 3, there's a compulsory session on prevention and infection control, which obviously the students have to attend. And then sessions on sepsis and meningitis. So there's more education on managing infections in year 3. And then in year 4, we cover the clinical aspects of COVID in year 4. And in year 5, the students will get lots of clinical cases relating to the latest guidelines in managing infection control. In terms of managing the safety of the students and their contacts, so before we came back to the university, there was Legionella testing in the university. The staff returned before the students returned to campus. We've had to adhere to SOPs, so the standard operating procedures, so there must be 2 meters distancing between students in the clinical skills area. We can only, at the moment, have 25% occupancy in the university. And then we've had almost like a dress rehearsal with the 5th years. So we've had the students back for the teaching, and we will have them back for the exam, so we can iron out any difficulties before term starts in September time. Okay, thank you very much. Johan, have you anything to
I mean, I think Dr. Julie covered most of the academic parts, but I think just to add on, talking about like when this pandemic came about, like it's a sudden thing, so you can't really schedule seminars or lectures really to teach about it. And I think the university did do quite a bit in that when this happened. So a lot of students were quite worried, and people aren't sure what's going on, and they're not sure what to believe because there's a lot of rumors on the internet. There's a lot of things you read. So what happened was, first the university sent out a lot of emails, telling us what's actually happening, how many cases there have been, what's the latest news, what's happening with universities and things like that. So it was reassuring to know that you have a reliable source of information. And there's also a very nice lecture from one of our lecturers, Dr. Edmund, and it explained the pandemic quite well, and it told the students what the risk was, and it kind of just made sure that everyone really understood what was happening. So you didn't go around spreading false rumors, or you weren't living with some misconception about what it was.
Okay, thank you very much. I'll address this question to you again, Kuhan, if that's okay. How do you think medical students can respond to the pandemic if they want to play a more active role in combating COVID-19?
I mean, I suppose if you mean like the most active thing they could do was probably initially you could volunteer at hospitals or other medical facilities. But then again, that's a very scary thing to do because, you're not even sure whether you know enough about it to protect yourself. How can you help others? So I suppose that's just the most extremely active thing a student could do. But in general, I think that the best thing any student should do is they should practice all the measures in place. So wear a mask, socially distance, continuously wash your hands. Because if you don't practice those steps, then you're contributing to the problem. So in that sense, first you have to focus on following the protocols and measures in place. And then as a medical student, you have to ensure that the people around you, your family, your friends, people you see, that they all as well follow these protocols because you understand why it's important and you know that like what's going to happen if you don't follow. So it's your role and your duty to actively ensure that people around you are aware and that they as well follow.
Thank you very much. Julie, same question to you.
I think just to probably echo what Kuhan said, just ensuring that the students adhere to sort of government guidelines about reducing the risk of COVID, but also obeying the SOPs in the hospitals and also in campus. I think we've had one student over in Singapore who's volunteered in a step-down facility. So in Singapore, if you're diagnosed with coronavirus and you're not physically unwell, you'll be put into a step-down facility. So this particular student has been volunteering in that step-down facility. We know that there's been some other students that have been volunteering with the NGOs, so working for Mercy Malaysia. And Dr. Fiona and I were interviewing some of our ex-NUMED graduates a couple of weeks ago, and they talked about how they were educating their family and friends and trying to reduce the spread of false information. So I think there's a few things that students can do personally, but I think also doing volunteering in various organisations, but that's a personal choice as well.
Thanks, Julie. Chris?
I think in the first instance is what we haven't done is we haven't asked our students to volunteer in any of the local hospitals during the COVID pandemic. The reason being, I think that one, the hospitals hadn't asked us for that to be done. And secondly, I think that there was a worry that the students maybe didn't have the prerequisite skills with those problems at the moment. So we probably won't be asking students to volunteer. We have had a number of staff, though, who we have seconded to the Ministry of Health, and they've been working in some of the hospitals over this period. So I'd like to thank our staff for doing that. I think it is how we can go forward with students as we go on. I think a very important thing is going to be the economic crash that comes and the economic problems that will happen as we go into the next year or so. And this is going to be very much hit some of the NGOs that we work with, some of the support for disabled NGOs, support for patients with Alzheimer's, support for other psychiatric care. So there's a range of things that we have. So I would actually hope, although it's not me to do, that maybe the student association, when they come back, they can start feeling about, are there ways that maybe we can do things that maybe help raise funds for these associations, because they're going to have some difficulties. So I think as a student group, we do work very well, and our students do work very well with the community, and they do lots of things, but maybe not doing some of the hands-on things where we send students into kampungs to actually do health camps. That may be considered that's not appropriate at the minute with social distancing. So it might be something different that students have to try to do to think about how to support the local community. Because I one of the things I really want is to make sure that NUMED is felt of as part of the Johor local community, and I think we are. I think we do things, particularly the students, and I think that we need that to go on and to show that we are part of Johor and JB, and we're trying to support locals in the community as we go on.
Thanks very much, Chris. So Chris, we'll have our students returning to campus in September. What preventative measures is NUMED undertaking to make sure that they're all safe and that they all practice social distancing?
I think the first thing is, I'm sure everyone knows that actually we have to work to guidelines that are laid down by both the Ministry of Health and the Ministry of Higher Education. So these get published. They're quite generic because they're published for all universities, and then we need to look at those and then work on those. So I will say that both the professional services team and the academics have done a huge amount of work for allowing staff to come back to campus. So staff were allowed to come back to campus in June. And now we've got students and staff came back, our fifth year students in July. So what we work is on these standard operating procedures. So if any students come back now on campus, you will see there's all markings on the floor to say which bits you can walk along and which directions you can walk along and various bits and pieces. You can see that there's a hand sanitizer all over the campus, up on the walls. Some areas have been closed down because we won't allow students to use some of the social areas at the moment because we feel that they'll get too close. We also obviously have social distancing on campus. So social distancing on the campuses is slightly different from the rest of Malaysia because we're asked to do 2 meter social distancing rather than 1 meter social distancing. So there's a range of things we put into campus. So is what we'll do as students come back, we will give a online briefing to students that they must attend. It's compulsory to attend. They have to see this online briefing, and then they will have to come to this online briefing, see what the standard operating procedures are. They'll have to fill in a questionnaire about their health, and then they're allowed to come back. The most obvious sign is that we have temperature checking as you come in to campus. So you will get your temperature taken as you come in the morning. So I suggest all new students come in at least a few minutes early in the morning before your classes, because there might be a little bit of a hold up. And then I guess is what we're working on is that it's everyone's responsibility to keep safe on campus. Students, staff have to realise that you are keeping each other safe. And that doesn't just include you, it includes all of our cleaners, it includes all of our security guards, it includes any contractors that we have on site. Medicine is a professional degree, so we will be expecting you to behave professionally. If students are congregating, I would expect other students to maybe say to them, please, can you not congregate? And the same, if you see too many staff in an area all chatting with each other, I would expect students to go and tell them that they shouldn't be there in that group as well. So I think it's about a professional behaviour. But the one thing that we have maybe that's very different from other universities in Malaysia is that it's a professional degree. Students know that they have to behave professionally, and maybe this will this professionalism that students have will help as we go forward.
Thanks, Chris. Kuhan, what do you think about that?
I mean, I understand where Prof. Chris is coming from and his point of view. And I think for the most part, a lot of students will understand. But I do think that there will be some, not everyone's going to be happy because, you're going to be walking around and when you see your friend, you want to say hi to your friends, you want to talk to them. But if you're not allowed to, it's going to be really hard, especially if you don't think there's a need to. But I mean, what Prof. Chris said is, it rings quite true, that you really have to understand that it's something that you have to do, and as a medical professional, even more so. But it is a bit sad that there's going to be, a lot less social events, and there's going to be changes in what the culture of the university will be. So we're not going to have as many events in the first semester. But I mean, hopefully, as time goes on, the number of cases reduce and the SOPs change, and finally we'll be able to bring back all the various events and traditions that make NUMED what it is.
If I can quickly jump in there, I mean, I've always felt that the social aspect of university is very important, and we know that the Student Association does fantastic, has a range of fantastic events throughout the year. I always like the Chinese New Year and the Deepavali parties that people do. They're always fantastic, great time, great dancing. And I think, as you say, that these social events are very important because they bond staff, they bond students together across all the different groups of students. And as the SOP change, then the SOP will allow us to allow more of these things going on as they happen. So things have very rapidly changed over the last 2 months, and I'm sure things will very rapidly change as long as Malaysia and the Ministry of Health, which has done such a fantastic job in controlling COVID, as long as COVID is still managing to be controlled over the period, over the next few months, I'm sure we will be allowing more of these social activities. And remember that this is where we're asking students on campus. Now, students shouldn't be meeting in too big a groups off campus, but you will be able to meet with your friends off campus in smaller groups as long as you're meeting the guidelines laid down by the government anyway. So maybe as I said, on campus is what we're thinking about. Is we have to be very careful that we are thinking of, it's not just our health. I may have said it before, but I think people like me who are getting a bit old and grey and losing their hair, we're probably more at risk from COVID-19 than maybe the younger generations. But then if you think that some of our cleaners are relatively old, some of our security guards are relatively old, you have to think about you're trying to keep them safe as well. It's not just yourself.
Thank you very much. So my final question to Chris, can you describe for us the university's plans for the upcoming academic semester and year?
Well, I think as we're going on, as I said, things are very rapidly changing. So currently our plans are, we're allowed to bring our final year medical students back in September. They will come back, they will start their clinical teaching from September and they will go on. So they're allowed to come back on campus. We also have our first year medical students. Many people listening here today will be allowed back on campus as well as our first year biomedical students and our foundation students. So they're all allowed to come back on campus. Currently, as I said, we have got social distancing on campus of 2 meters. And we've only got a maximum capacity, the rules are, of 25% of the campus capacity. So is what we're going to have to do is our teaching as we go into next year, currently as we understand it, it will be a mixture. So there will be some face-to-face teaching, particularly for medical students. That will be along the lines of the practical skills you're learning in the clinical skills laboratory, in the anatomy laboratory. Maybe some seminars will be held face-to-face. Big lectures, we can't get, we can only get about 40 students in a 200-seater lecture theatre, so they will have to be done remotely. And then remotely, I think Julie mentioned earlier, you can do this by 2 different routes. You can do this by what's called synchronous lecture. So is what you would have is myself speaking live in a Zoom session to 200 students and giving a lecture. And that's what I will probably do because I like speaking and I can see an audience and they can see me. Some staff may produce new recorded lectures and then that's called asynchronous. So you can have that lecture. Students can look at it in their own time, and then you can have a seminar afterwards to discuss what's been in that lecture. So there'll be a number of ways that what we're doing. Now, many people I may know here that the Minister of Higher Education gave a speech on Tuesday this week, which detailed that all students will be allowed back onto campus in October. Now, we haven't got the full details yet from the Ministry of Higher Education as what that means, what the social distancing will mean, what the what date that's going to be, what we can teach on campus and what we can't teach on campus. So we're waiting for those details, which should come out early next week, and then we will inform students, and then hopefully that will mean that we'll be able to get our year 2, 3 and 4 medical students back on campus by October, although we do need to know the final details from the government about that before we can actually make a final decision on that. And then going forwards, as the COVID numbers remain very low in Malaysia, in the last couple of weeks, we've had less than 10 cases a day for most days, I think, except for yesterday, for at least the last 2 weeks. Then as cases stay very low, I'm sure the Malaysian government will open up more. And then the hope would be that we'd be back to full campus teaching by January 2021. And that's what I'll keep my fingers crossed and say, hopefully we'll be back for that for the new year.
Thank you very much, Chris. Well, that's been a very interesting discussion. Thank you all for your input. I believe you're all happy to take any live questions if anybody wants to submit a question to us. Okay. How do you keep the mental health of your staff and students in check? Perhaps I can give that one to Julie.
Sure. So if students and staff feel that they've got any mental health difficulties, then they can approach other members of staff. We have the new med counsellor who's not teaching or examining students, so she's independent of other members of staff, so students and staff can access her. And as Chris said before, we have access to the psychiatrist as well. So there are lots of resources available to our students, and also the academic mentor. So it doesn't necessarily have to go to the student. You don't necessarily have to go to the student counsellor first or the psychiatrist. Generally, you would approach your academic mentor and raise any issues that you had there.
Thank you very much. So, will campus-based classes resume in October? I think, Chris, you've discussed that. Maybe you might want to just add a little bit to that.
I guess that, as I said, year 1 and year 5 medicine will be have some teaching on campus. This all depends on the social distancing that the government asks us to do. If we're asked to do 2 metre social distancing, we can get less students on the campus at any one time. If we're asked to do 1 metre, then we can get more students, and depending on what the government tells us what the capacity of the campus. Our campus capacity for students is over 1,000. So if we're at the moment, our campus capacity is at, we're allowed 25% maximum capacity, so that's only 250 students. So we can't have all students on the same. So this is all dependent on what the government guidelines are, but we would hope that we can get at least some face-to-face teaching for all students by October, but we need to find out the government comments. I have just noticed that there is a comment above that question about international students, and if I can just address that very quickly. At the moment, the Malaysian government have said that they will be opening up the borders for international students to return to Malaysia for teaching from October. So that's their announcement that they've made. We currently do not know what the processes will be. So we don't know how that's going to work. So will students have to have a COVID test before they come? Will they have to have a period of quarantine when they come back? As soon as we actually get that information, we will pass that on to all of our students who are applying to us for the new academic year, and all of those students who are our current students, and let them know. So that's something that we're waiting for. As soon as we got that information, we will pass it on, and then we will let students know what to do. Unfortunately, I can't give the answer today because I don't have that answer at the very moment today.
Thanks. So, what if I need to take leave of absence as a result of the impact of COVID-19? How will this affect my fees? And again, I'll give that one to you, Chris.
Yes. So once again, so this is a number of things. So what you might have to do is say if a student was in say a different country, say they were in the Gulf or somewhere like that, and the borders were closed and they couldn't come across to us, then I guess that is what we would have to look at, particularly in the clinical years, is a student might have to have what we call, they would have to suspend their studies for a particular year. Obviously, if they're suspending their studies for a year, or then is what they would have to do is that there would be no fees for that year. If the students started with us and managed to do a semester and then had to go back or something like that, then and then suspend their studies, then we would proportionally withdraw their fees. I think this is difficult at the minute to work out what we're doing with international students because we don't know exactly which borders will be open, what borders will be open, and how students can come back. Because it doesn't just depend on the Malaysia border, it depends on the country of origin borders as well. So we will have to look at that carefully over the next few weeks to work out what we can do. And I guess this is also the same for staff, because just as a quick thing here for staff, so staff can't return home. So myself and obviously Julie and Fiona, at the moment, if we went back to the UK, we would have to have 2 weeks quarantine in the UK and then another 2 weeks quarantine when we came back in Malaysia. So it is very difficult, and we're trying to manage both our students and the staff as international members of staff and international students, how we get back and how we work.
Thank you, Chris. So another question: do you think post-COVID situation will affect next year medical school admission requirements and time of admissions?
I can answer very quickly here. It won't change requirements. Requirements will be the same requirements as we have. We can't lower requirements. I think is what we know is that, and just from my point of view, is that we set our requirements quite high. You are coming to an excellent medical school. You are expected to work hard. It is hard work. We know that the requirements that we set allow students to actually pass and progress. We're not here to just recruit students for money and then let them fail. I expect 100% of my students to pass if they possibly can, if they're working to the levels that they can be. So we won't be dropping admission requirements. There may be some changes in the way that exam boards look at things, but that's the exam boards, but they will be giving to us. And I think that actually for next year, for 2021 and going on, the likelihood is that if we remain as we are in Malaysia, that our entrance requirements, entrance dates will be the same. We have to monitor. So for medicine and for biomedicine, we have to have our entrance at the same time or around about the same time as the UK. So that will probably be September next year. We are a little bit more flexible on our foundation program. So we put back our normal May start of our foundation this year to June for a number of reasons, so we could prepare the program, although our September entry is the same. So the likelihood is that will be a normal entrance time and normal entrance requirements.
Thanks, Chris. So will first-year international students be able to catch up on any missed clinical lectures when they're able to come to Malaysia?
I can answer this one as well quickly. Yes, so what will happen is we do understand that some international students may not be able to come to us. There will be sessions, different sessions that are put on. So although the students on campus, we will run those, students who have missed these, we will have to catch them up because they have to be at the same standard to go into year two, because the skills that they've learned will go into year two. So there will be catch-up sessions, there'll be very intense catch-up sessions to ensure that any students who have missed anything meet the same standards, because they've got to meet those requirements to pass the year. So we will have sessions for students, and hopefully would be opened up for all students by January at the very latest.
Thanks, Chris. Okay, I'll let you take that, Chris.
This keeps me busy. So the answer is no. This does slightly change on the third and fourth year students, as Julie mentioned earlier. If students can't come back, which was the previous rules by the Malaysian government, then there would have had to be a shifting around of the syllabus. If students can come back, hopefully we won't have to shift it around so much. But what I can say to all students is that you will be told in plenty of time what the syllabus will be. And once we've decided on the syllabus, even if there are changes by the government, then we would not change that anymore. So what we will do is we will let students know at least a month in advance of what the structure will be. And then we will let students know when all the exams will be. So you will have plenty of time to actually plan and know what's happening. I can't tell you now exactly because things are happening and changing very rapidly, but we'll do the best that we can. And then once we've said this is how the year will look, even if the Malaysian government suddenly changes something in October or November, then we will keep that year to that year, because we can't keep swapping and changing, because we do understand that by chopping and changing all the time, that does cause worry, stress to students, and it will also cause worry and stress to staff, because they suddenly have to change the way they're teaching within a week or two. So once we've made the decisions, this is how we'll go forward, then everyone will be communicated those decisions, and then they will be able to go on from there. I can answer this one as well, if you like. So this is about the biomedical sciences degree. Firstly, yes, it is a full honours degree. So the 3 years degree, UK degrees, especially in England, are honours degrees after 3 years, unlike maybe Australia and other countries. So it's a full honours degree after the 3 years. Is it equivalent to the degree? Yes, it's exactly the same as the UK degree. It has to be, actually, because the final year you will be studying in the UK. So we have a group of students who will be moving to the UK in September. So the degree diploma, the degree certificate that you get for either our medicine degree, our biomedical sciences degree, or our foundation, it just says on the degree Newcastle University. It doesn't say Newcastle University Medicine Malaysia. Actually, I think the certificate might even say University of Newcastle upon Tyne, because that's our proper name. But the degree certificate from Malaysia and from the UK is exactly the same. And you couldn't tell the difference from a student in the UK or Malaysia. You wouldn't know the difference between the degree certificate. So it's exactly the same.
I think this is probably to you again, Chris.
I think I mentioned this before. So happened to the first year clinical and laboratory work. The clinical training, you would get the training, although the students who were on campus would get that clinical training. Anyone who came back late in semester 2 would actually get that clinical training at a later date, and there would have to be a more condensed course for those students who would have to probably be taken separately and have some extra sets. Actual separate sessions at a later date. So we do understand that some students might actually have to come in late. So we will do that. Currently, there is a question there on, can semester 1 students do semester 1 online? The plan is for first year students is that we would be offering for students who can't come to Malaysia for whatever reason, is that what we would be offering is the teaching here on campus, but the teaching would be also delivered off campus. So those students who couldn't make it to Malaysia would have the majority of the material. Obviously, the clinical training would have to be picked up at a slightly later time when they could make it to campus. So yes, freshman students can do semester 1 online at the moment. Preferable if you could get here if you can, but we do understand that you may not, and we will then catch you up with everything you need as the year progresses. Well, I see a next one. I'm seeing you doing all the answers here, but no, it won't make any changes, because the changes to the program. So is what people. This is educational jargon speak here. Is what the program has is what it has is learning outcomes, and you have to meet those learning outcomes before you graduate. So is what we have is a list of things on the medical degree and some of these are skills, some of these are knowledge based, some of these are practical skills as well. So is what you have to do. You have to meet all of these outcomes before you can actually graduate from the course. So we are making sure that we're not actually making any changes to the outcomes. It's just the way that we're delivering the program. So that any student who comes on our program, anything that we do, you will meet all the learning outcomes on the program. So we will meet both GMC and MMC requirements. So you will have the full accreditation of both bodies as we go through. So we're not changing is what you have is program learning outcomes. You will meet those learning outcomes, and that's what we've got to make sure as we deliver the degree as we go on.
I'll maybe give you a break, Chris, and pass this one to Julie.
Okay. So can I obtain housemanship in the UK after graduation? So currently, NewMed graduates can apply to the UK Foundation programme in the UK, but that may change within the next 5 years, and that depends on immigration rules in the UK. So currently, yes, you can apply to the UK Foundation programme from NewMed, but that may change within the next 5 years, so that's not an absolute certainty. Can I also register with GMC without writing a PLAB examination? So after you graduate from NewMed, you will be eligible for provisional registration with the GMC. If you get full registration with the GMC, then you will not have to do the PLAB exam. Okay.
I think this is for me again, and the answer, I think I answered it before. If the border between, so if the Malaysian border is closed for you to come, or the border where you are is closed, so you can't come out of your country, we will allow you to do the first year, particularly the first semester online, and we can do that. So yes, we will allow students to do that in the first instance. And jumping on, we had the next one about exams. Will there be some leniency? I guess is what we have to look at. All of the exam boards are working slightly differently, and I'm very sorry, I don't know what exam board you're on. So we have students doing A-levels, students doing international baccalaureate, students doing India higher certificate, etc. So is what we'll have to look at is each exam board as they go along and find out what is being awarded. We have to, by law in Malaysia, the law from the Malaysian Medical Council is that there is a lower limit that the Malaysian Medical Council will allow you to study medicine, and we can't go below that. So I think is what students have to do is come to us, and you'd have to have actually a discussion with my admissions team to say what qualification you're doing, what your grades were, what you will be awarded by your exam board, and then we will have to talk to each student individually about how we'll go forward with that. But the admissions team we do have at NewMed is excellent, and they do know of the different qualifications that we have. I think we have students with about maybe 30 or 40 different qualifications here at Malaysia. So we do know what's happening, and then we will advise you appropriately. Another one I can answer. Well, this one is quite easy. So is what we'd have if you study the biomedical sciences program, you can take a choice. Actually, is what we've been doing is we have a graduation. Students can graduate in the UK with the UK cohort of students. While they're doing that, that will normally be in July. Or students can choose to actually come back if they want to have more of their family and various things, and then we can have that be part of the NewMed graduation. Unfortunately, this year we can't have a graduation for our students, so we're looking at what we can do, but we will probably have a virtual graduation, but then we'll offer the chances for students to maybe graduate with us and have a double set of graduations next year. So yes, you can graduate in the UK or you can graduate in Malaysia. That's totally up to you. That's to you to choose.
Do you want me to answer this one? Can I do part of my medicine in the UK? So prior to COVID, there was an exchange program in year 2. So some of our Malaysian students went and spent the first semester in Newcastle, UK, and then conversely we had Newcastle, UK second year students coming to Malaysia for the exchange program. There's also, I mean, again, prior to COVID, there was the summer research program, and a lot of our students had chosen to go to the UK to do their electives. So there are several opportunities along the way to go to the UK. Obviously, things are different with COVID now, so with travel restrictions in place, then things are very different at the moment. Next question: since cadaveric dissection isn't allowed in Malaysia, how do anatomy classes take place. So they take place in the anatomy lab, and it's usually models that students will have, and they can take the models apart and get an idea of how the body works. Is it possible to do dissections during the UK exchange part of the programme? I don't know the answer to that. I don't know if anybody else knows the answer to that.
Can I just quickly add in here? Yes, we don't do cadaveric dissection here for a range of reasons. I think is what students should think is that we've done a lot of work looking at our UK students and our Malaysian students on anatomy, and we find that there's no difference between the actual results that students get on their anatomy, whether they do or they don't do the cadaveric dissections. I know it's something people worry about. I think in the UK as well, many more medical schools are changing to non-cadaveric teaching of anatomy as well. So it's not something that is unusual. I think that in the exchange that we have, which is a second year exchange, as far as I remember, that there is options to do the cadaveric dissections in the UK when students go across. Unfortunately, that second year exchange has been cancelled for September this year because of the border closures and various things. And we will review that as we go into the 2021-2022 academic year to let people know as we go along. Unfortunately, is what we have. Malaysia has done a fantastic job, as I said, on with MOH controlling COVID-19. Unfortunately, and probably my colleagues from the UK here will agree that maybe the UK hasn't done quite as well. There's still quite a lot of cases, and it's still going on. So actually, it would probably we probably wouldn't allow students back, and there would probably be a whole range of quarantine procedures if you went there at the moment to the UK. But as soon as the borders open up and as soon as it's okay to go back, we'll get back students to the UK as quickly as possible.
Will the library be open in September? So the library is already open, so yes, it will be open.
Yes, it will be open. At the moment, we have so that our library, our computer facilities are open, so our final year students can use those facilities. They will be open as we go back in September. There will be, at the moment, due to the social distancing requirements, we have to have booking. There's a booking system that students have to use to book the library, which I know is a bit of a pain, but that's what we have to use at the moment because we don't want all the students, when they're not having lectures, going into the library and all meeting up. So we obviously have to meet those social distancing requirements. As these are reduced as time goes on, then hopefully we'll get more students into the library and the computers. I think we can ask Kuhan about this.
Any thoughts, Kuhan?
I mean, you can ask me, but I'll be asking you back because it depends on what the university tells us. Ideally, we'll be able to function as normal, but I'm pretty sure with the SOPs and standard social distancing, it will be quite different. So I'm not sure how events and all will be held.
I think this is playing things as we go along. I think that we want. As I said earlier, the social aspect of being on university is very, very important, and it's just as important as the academic and the teaching. The friends that you make at university will probably last your life, as Julie and Fiona and myself will probably tell you. I think it's difficult. It will be difficult. I think that there might have to be some online Zoom sessions when you're trying to get the freshers to join the clubs to start and do things like that. And then, but as we go on and as the social distances reduce, then we'll be able to allow the clubs and societies to meet and the clubs and societies to go on. But I think that you do have to consider once again that this is for the safety of all staff and all students. That is what we want to do, is make sure that we're not being killjoys. We're not stopping you doing it because we don't want you to do it. We would like you to have the clubs and societies, but we can't. We can't in those first instances. But as soon as we can open up for you, we will open up as quickly as we can. I'll just answer this for the moment. At the moment, the student exchange program, as I said, isn't working from this September. So there's no students exchanging to the UK this summer. this September, and we aren't having any UK summer research places this summer either. This all depends on the COVID-19 situation in both Malaysia and the UK as we go on. So I think is what we need to do is we just need to review that as we go on. As soon as we can open up, as soon as it's safe to go to the UK, as soon as there isn't elongated periods of quarantine at both ends, which might cause problems, we will open these up again. But it's all to do with, obviously, as you understand, safety for students and also the ability for students to get across and do anything sensible. New intake is, as far as I remember, the teaching starts September the 28th for the biomedical degree, and I think that's and I think it's the week before September the 21st for the MBBS degree, and I think the foundation is September the 28th. Someone can send me a message and correct me if I'm wrong, but I'm pretty sure that's the new intakes this year for all of the students. They're slightly staggered for a number of reasons. If someone has a BSc honours degree in Australia, can the credits go to the medical subjects? I'm afraid not. We don't allow credit transfer onto our medical degree. If you've got a BSc honours degree in Australia, you will have to come into the first year. A lot of what's taught on the medical degree isn't covered in your BSc honours degree, and the way that people look at the anatomy, the biochemistry is very different, because you may have learned a biomedical degree and you might have learned very much basic biochemistry, basic microbiology, but obviously with the medical degree it's linked to clinical case scenarios. So we don't allow any credit transfer. So even if this was a student at Newcastle in the UK who'd done their BSc Biomedical Sciences degree, there's no credit transfer. All students will go back into the first year and start from the first year.
Okay, it looks like that might be all the questions. Yeah, so I would like to thank all of you who have sent in questions. They've generated some lively discussion. Thank you to all the audience, and in particular, I'd like to thank our panel who've given you some great answers, and I hope you found that helpful. So thank you to Chris, Julie, and Kuhan.